So you have to make it the most entertaining thing
Yes.
ever. And I mean, I'm lucky in the sense that I do sound like a cartoon character, so that grabs their attention.
Yes, Jen and I are delighted to have Erin Casper joining us. Erin and I go way, way back to the time before I was a nurse practitioner and I was working the night shift in the ICU. Erin was a nursing assistant and she was amazing at her job, so caring for all of our critical care patients, so incredibly helpful for all the nurses, and just an overall calming presence. And, really, even going back to that time, it was obvious how holistic healing was kind of running through your blood.
Yeah.
And around 2009, Erin became an LPN, and she actually left the hospital where I was working. And fast forward from that time, Erin she was an LPN, and she started exploring holistic modalities. So, Erin, could you share with us a little bit um, about yourself and your background and what led you truly into this field of working with kids with special needs?
Okay, so we had met in 2001 when I started working at Mather Hospital as a nurse's aide.
Mhm.
Before that, I mean, I've worked in the healthcare since I'm 14. On my birthday, I made my mom take me to become a candy striper. So since then, I did home care, then what became a nurse's aide, got my job at Mather, was working ICU, CCU overnights while going to college to become a nurse. And I took a yoga class as a gym class in college. And I immediately knew that yoga was it. Like, but in 2001, it's not like you could become a yoga teacher and support yourself, you know. So I continued on. I went, became an LPN, then I left the hospital. But while I was working in the hospital, I was also working in a group home for individuals with special needs and fell in love with that population. I joke because I'm a talker and a lot of them are nonverbal. So I'm like, but we could communicate anyway, but I filled all the space. But I just knew that my nursing and the holistic somehow just went together. Because when you're working with somebody that's nonverbal, especially, you need to communicate in a different manner. And it's almost like an energy exchange, whether you're just grasping what they're like their facial expressions, but I'm also a Reiki healer, so you can feel where their issue is. So that being said, I started doing home care nurse. I bill insurance myself and I just started doing home care. While in 2019, I actually was buying crystals one day and saw a flyer for a yoga certification that was for children. And like I just knew this was it. Like now I can, because 2019, people actually started doing yoga, knowing what yoga was more about than 2001. So I started taking these certifications. My teachers actually was based out of Virginia, but it would come to Long Island and have weekend workshops where we would get certifications. And then COVID hit, and I started doing it all online. But one of the, I think, 35-hour certifications was for children with different abilities. And this was just like the connection, like the total connection. I love this. And it was incorporating the yoga that everybody knows, but simpler, like making it silly. and making it actually reasoning, like learning the reasons why behind what works for this population. And I just I fell in love with it. I got my 200-hour certification, finished that, and at that time COVID hit. So since I was already doing home care, I just started incorporating this into my home care nursing. But
Oh,
as a nurse, you document everything. So there I was taking the vital signs and just playing like peaceful music,
oh,
watching their pulse ox change, seeing their
wow.
respirations change, seeing the grimaces on their face change to smiles. And I mean, like with kids with special needs, like if you start chanting or humming, they're always going to giggle. So,
Right.
right there, if you're laughing, you're not feeling the pain for whatever, however long, it's changing your neurons and your receptors. So, incorporating all of these things, I was getting actual nursing like
Results.
readings, yeah,
Yeah.
results, like positive results. And that was it. And from there, I started contacting group homes. And because I did work in a group home back then, a friend of mine was now a nurse and managing a house. And she's like, start coming in and let's do group lessons. So I would go to the individual group home. But now, if like group homes, and especially for kids, everybody's, all in a wheelchair. A lot of them have their medical issues. You have to, even if it's five kids, it's everyone's doing something else. So you have to make it the most entertaining thing
Yes.
ever. And I mean, I'm lucky in the sense that I do sound like a cartoon character, so that grabs their attention. But I'm known to go in dressed as a butterfly
Oh.
or a big hot dog. And yeah, and come in with there's always bubbles involved. There's always, some sort of weather where it's a game. It's an entire adventure. It's not just a yoga class. It's basically a fishing trip, which will start with tapping because we have to put on our sunscreen. And what I've learned with the kids with sensory issues, the harder you tap, the more they're gonna realize it.
Yeah.
It's called proprioception, and that's kind of pounding on them. It's not hurting them. It's making their senses realize there's place in space, and
Yeah.
it calms them.
I just love how your background as a nurse has so influenced your work as a yoga instructor. And then the other thing that makes you so unique is here you are in hospital settings or in these group home settings, whereas so many yoga classes are, at yoga studios and but you're able to really bring your work into a hospital setting. And so for children that have cerebral palsy, I'm just thinking about my son, when you talked about how the blood pressure would lower when you would come in,
Mhm.
what a gift that must be to parents who have children that are, for the many hospital visits that they have, if they have a surgery or, they're having some oxygen issues or whatever it is, that someone like you can come in and really give them this tool to help, with everything that's going on around them. And I just find that so unique. That's amazing.
And I also love how you are incorporating the foundations of so much of holistic healing, like the tapping and the breathing, visualization. So all of these are components not just of yoga, but of Qigong.
Yes.
There's emotional freedom technique that involves tapping. So we know that all these little components are beneficial from all of these different modalities. And to be able to take those, combine it with your knowledge of the body and the physiology, and, being able to explain to parents that, we're doing this not because, we're just being silly because it's for kids, but because there's a true medical result that you can see in vital signs and you can see in their behavior and their comfort level. So that is just really inspiring.
Breathing, just breathing.
Right.
Nobody knows how to breathe.
I also love, Damien had taken a movement class earlier this year, and a lot of yoga was being incorporated into the class. And he got very frustrated in a few classes because some of the poses, he was trying so hard and he can do so much, but yet some of them were just physically, he couldn't hold some of these poses. And I wish that we had had you in this situation because he ended up feeling discouraged because he couldn't do what some of the other kids were doing. Can you talk about in cases where you have maybe a mixed group and maybe you have some with cerebral palsy and maybe you have some without any physical challenges, how are you able to adapt that class?
Well, being a nurse helps a lot in that aspect because mostly, like, yoga instructors really shouldn't be doing hands-on. I mean, they can come over and assist you and point you in the right direction. But because I'm a nurse, and this even works with my Reiki certification, I'm allowed to touch people. So with the people, the children in wheelchairs or different mobility issues, I go and physically, I call it passive yoga because I physically assist them in the pose and hold them there while we're breathing.
Okay.
And the type of yoga that I'm trained in is called Kundalini yoga, which a lot of people don't know about. Kundalini incorporates your seven chakras. So the chakras are the points of your body that holds energy, and Kundalini is a repetitive motion, like a continuous motion and chanting and breathing, which moves the energy through the chakra. With medical conditions and Eastern medicine, a lot of what they believe diseases is energy stuck within a certain chakra. And since I have the knowledge of both medicine and the yoga, the Kundalini, I specify a specific asanas or poses, like a yoga routine, specifically towards their medical condition.
That's amazing.
Yeah, it's
Yeah.
very, I'm an LPN. So instead of going on for my RN and continuing on there, I went the holistic route. I started, like I said, at 14. I was always the nurse's aide. In my mind, I'm the nurse, but I will always be the nurse's aide. I'm hands-on. I'm the one that wants to be there to help you. I don't want to have to write about it and tell the doctor. So I'm like, instead of taking documenting courses on nursing, I'm just gonna find out how we could be silly and breathe and move. I mean, one of the best poses for kids like with autism that's having an issue, like is it called the burrito roll? And you roll them back and forth in a blanket like a burrito. Like, how calming and relaxing is that?
Absolutely. That's amazing.
Oh, that is great. So you've talked a lot about some of the different things that you do. Could you walk us through like a typical session, like from start to finish, what that might look like?
Okay, so since we're moving into summer and I started telling you about like we're gonna go on a fishing trip. So I walk into class, I mean, with basically my fishing cap on. I have enough fishing poles, plastic, of course, for, everybody to participate in. And it's a lot of like games, So there'll be a flopping fish on the ground, but I come in, I now put on music. I actually like to put the lights down and I have like light machine. So if we're going fishing, I would put blue in the room so it looks like we're in the ocean. And now I'm telling everybody, I mean, I do go around and we do a little, warming up first. And I physically go around and take them, and we all do a couple of our breaths. And I explain to them what our class is going to be about today, that we're going on a fishing trip. And I do like to start with the tapping because it's now getting everybody's neurons firing. And there's a thing called brain gym, which it's incorporating like crossing the midline of your body. By doing brain gym exercises, you're actually activating both left and right side of your brain. So this is, I mean, amazing because I mean, even for us, how many people are walking around with both sides of your brain activated? We could both talk about stories that aren't activated. But so we start doing this. We warm up, we take our breaths, and now I go around and I do like to incorporate aromatherapies as well because it just calms everything but gets you more into the mood. So we have the lights down and now I start tapping. And since we're going to go on a fishing trip, like I said, we're all going to need some lotions. We're rubbing the lotion in our hands and we're going to gently pat. And if they can do it, then they do it. Or sometimes I do hand over hand and apply their lotion for them. And then when we get to the limbs, we like to do a little harder because especially if somebody does have autism and is out of regulation and they're kind of flopping all over, hitting the neurons gets it fired so they can actually feel that their arm's here. And we go down the whole body. EFT tapping does have specific points, but we're just going to do big hands to incorporate every area. So, like I said, we put on all of our skin lotion so we're not going to get burnt. We put on our life jackets. And sometimes when we're doing our life jackets, if you have a weighted vest, or a weighted blanket because that's very comforting. And like I said, with the proprioception, if they can feel that where they are, and it's calming. Now we're going to get on the boat. A lot of it is me talking and explaining what we're doing, but now we're going fishing. So I grab their fishing poles and I go to everybody and we do it 3 times on each side. We'll have the fishing pole and I'll go back, breathe in and exhale. And back and exhale and back and exhale. Of course, on the 3rd time, they always grab the fish that's on the floor. And then we reel it in, which is using different motor skills. And then we do repeat on the same time. And I go around to all of them. But now after we're done fishing, we're going to want to go swimming. So we go around and we do some swimming exercises. So it is a little exhausting for me, I must admit, because I'm doing, like I said, passive yoga. And then I go around and all of their legs, I make sure I do a range of motion. So I am incorporating some yoga poses into it. I do like to, with the fishing and everything, like I said, it's the brain gym, so it's activating both sides. Then, by then it's the end of the fishing trip, and we're all gonna come back. And I do like to then do some deep breathing. And a lot of times it's just silly, like especially with since we're on a fishing trip, we're just gonna do wave breathing. So it would just be so you look like a wave.
That's beautiful.
And
Yeah.
it's just actually doing home care. I've taken care of like 2-year-old babies, and sometimes they get a little sassy, and you'll say, "Do you want to do some wave breathing?" And they'll go, "No," and you'll go, "Well, I do." And and just start getting in there, and then they're
Right.
like, "What are you doing? I want to do that too." So, yeah, that's basically a whole class. It's usually depending on how many people are in the class, but we do at the end, take a couple breaths with just nice, relaxing music. That's it. And they always love it. I mean, it's funny. I used to go on a Friday evening to Angela's house at about I think it was like 6:30 at night. So it was right after they had their dinner. I would come for an hour. So by 7:30, I like you could just the entire dynamic of the house had changed. And all of like the direct staff were so excited. They're like, "Oh, we love when you come," because you know that they're just gonna now roll them right into their rooms and everybody's come.
Yes, that's amazing. I mean, it sounds like you really tailor what you do to each client, each group that you work with. And from what I'm hearing, it just sounds like you have every trick up your sleeve that you can imagine. Is there anything that you find challenging, or you kind of just
You know what? It'll be sometimes that I plan too many things and I rush through I rush through it. And people will be like, "Can you slow down?" I was like, "I'm just trying to fit everything in." It's a lot of fun. I would always call my mom after a class and be telling her, and she'd be like, "Well, who do you think had more fun, you or them?" I'm like, "Me." It's always more fun for me.
And it sounds like too, you're able to do a lot of home visits because you also do the home care. Can you talk about some of the ways this is funded? How can parents find somebody like you to come into their home?
Well, right now, due to the fact that I am able to bill insurance, a lot of the insurance companies do actually have yoga as an alternative. Especially now, since for pain management, they want you to actually do yoga, massage, acupuncture. My dream is holistic centers bait for individuals with special needs.
That is great. So, is there something that a quick tool that you could share with the people that listen to our podcast that a parent could share with their kid, like in the moment? What do you think is something that's easy for parents to do with their kids?
Like if you're angry or like really like in it, we're being angry bears is what I say. And I say we need to take a bear breath. And I explain, I say it's okay to be angry, but like an angry bear, but we have to let it out. So what you do is you take all of your air in and you fill your belly, and then you make your bear claws. And now you're going to growl like an angry bear. 3 times, but let that angry bear out. And now do it again. All the way in and growl it out. and then a third. And after the third time, you ask yourself, am I still an angry bear? And if it's yes, it's okay. It's okay. Let's just let it out again. But if you feel better, let's just feel better. But it's exhausting, actually. And it really does. It's a way to incorporate actually the 4-7-8 breathing technique without telling somebody you're doing the 4-7-8 breathing
Mhm.
technique, because a 3-year-old doesn't care. So, but he'll breathe like a angry bear.
That also
That
sounds
is
like
great.
drama therapy, that you're incorporating drama therapy too, which is amazing.
Well, it depends who you ask. They'll tell you I incorporate trauma into a lot of things I do. And when I teach it, I actually, we all do wear bear ears. 'Cause you really gotta be the bear.
But I think that really gets to the heart of working with children,
It
right?
does.
So, like Jen was sharing, when Damien went to that other yoga class that was for kids, kind of my impression is that it was someone trying to teach adult yoga to
Yeah.
small people, as
Yes.
as opposed to really connecting with children
Yeah.
and the way that you utilize all of these different modalities to meet the kids where they are.
Well, I'm blessed that I was taught by who I was taught by. My teacher is amazing. She was a Montessori teacher.
Oh,
So she was
wow.
actually trained by Yogi Bhajan himself, who is the yogi that brought Kundalini yoga to America. So, I mean, she started training with him when she was like 17, and now I think she's in her late 70s.
Wow.
Is there a website where people can go to learn about this type of yoga specifically, or any books you could recommend? Kundalini yoga, it's called, right?
Yes, Kundalini, but the best book, and it's by her, it's called Fly Like a Butterfly.
Oh,
And it teaches, it's little kids doing all of the yoga poses.
oh, that is
That's
amazing.
wonderful.
Yes.
Yep. And her name on the book is Shakta, Shakta, Khalsa, Khalsa. She taught the children's part of the yoga. The other part that was for children with different abilities was actually, it's a couple. He's PT, I think they're both physical therapists, and they're stationed in Buffalo. So, because my yoga experience, because it happened during COVID, I did half of it in class, and then COVID happened, so we finished online, and I felt like I was gypped out of the experience. So I decided to plan my own trip to Buffalo. And I was like, can I come to your classroom? So, not this past February, the February prior, I drove myself to Buffalo for a little yoga road trip, and they allowed me to come sit in the classroom and did an entire day with the different yoga and with the kids with all different learning abilities. Yeah, I love this. Like, this to me, this is my passion. Like, right, I love what I do. I mean, I love just being a home care nurse. My one patient I've been with for 8 years, it's like we're family basically. I don't say I'm going to work, I say I'm going to her house, like.
Yes.
And just doing, like, I can plan trips. I'm going on a yoga retreat, like, this is my job, but it's helping people. It's amazing. And I just wish that I had known how to bear breathe when I was like 20 or 30, or, you know, or 3.
Right.
So, Yeah, I'm like, if I could just teach somebody a coping skill so they don't cry and have a meltdown and like ruin their day, then I did my job.
Yeah, it sounds like you're doing it every day. So
I
Yeah.
try. Yeah, it's my calling and I love it.